was months, about 15 to 20% of patients can get a really durable response, often 5 years or more now. So that is a huge game changer, and really excited for this work that is moving the forefront. So training our immune systems. All right, the second one, and this is pretty hot off the press, okay? Diabetes medications. 1 in 10 Americans has diabetes. And, you know, historically, it has been such a challenge for how do you manage this? More than 1 in 10 Americans. And so now there's a new class of drugs, GIP and GLP agonists, that can get your body not only secreting insulin again, but they can also do it by slowing down your peristalsis so that you're not emptying your food as fast, and it actually reduces appetite. So a study came out not long ago that showed that for patients on one of these medications that were doing it with exercise, that weight loss went from 6 pounds in the control group to 34 pounds in the other group, a 15% weight loss. So this is really promising as America deals with obesity. We've got a nutrition expert here. These drugs are not cheap, as you've pointed out before, but potentially this type of technology is game-changing, exciting. The next is, how many of us know somebody who's been impacted by Alzheimer's disease? You know, exactly, right. So many of us have had a loved one. For me, I think there are few diseases that take a greater toll on both patients and their caregivers. And so it's exciting that there is now a test for Alzheimer's that is 93% accurate, a blood test, to identify patients earlier at less than 1/10 the cost of the traditional PET scan. So we can catch people earlier and get support. Well, then the next part of it goes, what about treatments? You know, what can we actually do? And this just came out, but there's a sleeping medication, Suvorexant, that they found out that patients who took this drug for 2 days, just 2 days, it got better sleep, and that they had between 10 and 20% lower amyloid beta levels in their blood. So finally making progress on these diseases that for the last, 15 years of my career have taken a toll on so many people. So super exciting, innovative breakthroughs. Okay. You knew I had to put Evelyn's House in here. You know I've never gone through a talk without Evelyn's House. The duo that came up with the idea for Evelyn's House that have made my career are right here. Aya, you've got to take a bow now. Aya and Pat, really, yes, please. Thank you. I'll take the head nod. So, one of the challenges that we've had for years in our hospitals is that we do not always do a great job of getting patients information about where they're at with prognosis. So in the last year and a half, we developed a machine learning algorithm that goes through the whole chart, pulls in over 500 variables, so their labs, their diagnoses, everything, 24 hours after they're admitted to the hospital. And we then take this information, the machine gets a score from 0 to 100 and sends it out to us. And for the patients that are in the highest risk group, we let their doctor know this is a patient that deserves to have information. We don't actually give the scores, and all the decisions, I have to say this, are made by the patient themselves. That we only want them to get information because sometimes what the doctor thinks they want isn't exactly what was important to the patient and family. When we did this study with over 800 patients at our hospitals, we found out the patients that got the information were 3 times more likely to say, I don't want to be in the intensive care unit. What we were really proud of is that there was no difference in survival, 30-day survival between the two groups. the patients just got to be at home and didn't go through CPR if that's not what they wanted, or a breathing tube. So they changed their code status, but with no difference in overall survival. So this was exciting, and we just published this 2 weeks ago in one of the JAMA journals. So we were really excited about that. That's really cool, and you're all really impressed. Thank you, Mary. Thank you. Feeling the love. So this is really exciting for us. You know, I think it goes without saying, the last couple of years, that one of the biggest discoveries has been the advancement of the vaccines. And it's been really exciting. The vaccine that for COVID, the intranasal vaccine used in a lot of developing countries, came right here from Washington University. So that, you know, that work is pushing everything forward. These next two made me smile, okay? I don't know that they're the biggest advances in medicine, but a vibrating constipation medicine that makes your intestines squeeze. How cool is that? Constipation, real big in my field. A lot of the pain meds constipate you. So a vibrating pain medication, people, that's only $1 to $2 a day, $2 to $3 a day, sorry. But really exciting. I just had to throw that in there. And my favorite study, okay? For years, my 6-year-old and 9-year-old have been espousing the benefits of chocolate. But a study came out this year that showed in patients with advanced cancer, dark chocolate 4 times a day is actually maybe the most impressive appetite stimulant. And so that totally made my day. My kids stand justified. This is them doing a home visit with me last weekend, and the patient's family got them derby hats. So if we ever come over, they still wear them around the house. Derby hats are a huge bribe to get your doctor to do home visits when his wife is out of town. So these are just a few of the advances over the last year. And then in the next section, we get to the fun part. But I'm going to pause for a minute and ask you guys, as you're talking at your tables, because we're going to be a little pressed for time, I want to hear from you. If there are specific providers or programs that you want recognized, people are so burnt out. I bet all of you and your businesses and your families, et cetera, you've seen it too. But healthcare providers, and Angie with your nursing team, my gosh, and Angeline, you know, this is a really great time to send recognition to the people you think did a great job. So in your tables, if there are people that you want to highlight, and then in about 5 minutes, we will meet back and hear either the advancement that you've been most excited about over the last year, or a provider that you, or program you want to recognize. And as we go to that, I have one last story for the intermission. As we get ready for the what can we do even better, a story that happened a couple months ago that some of you may know is that somebody accidentally drove a car into our Center for Outpatient Health building, and one of my colleagues who was doing clinic there was like, oh my gosh, is this an earthquake? Ran outside, and the people got out of the car and went into the marijuana dispensary across the street like nothing had happened. It is awesome. So put a huge smile. And so with that, take a minute and think, you know, what programs or people should we recognize? And is there an advancement that you either were excited about or you want to see happen? So 5 minutes. All right, we'll go. Now, and I forgot to say to appoint a spokesperson. I see a lot of smiling. That makes me happy. So let's kick it off. Who is the brave table to go first? Dr. Codner, is that you volunteering? Okay, don't bring him to an auction. Who do, all right, I should have known. Let's go, Mahendra, good to see you. All right, let's go around and we will mic up our spokesperson. It looks like, yeah?
So that our virtual listeners.
Patrick, first of all, thank you for your presentation, and I think you missed your calling as a game show host. What I'm going to do is talk to the issue of what makes care better, and then John's going to talk to some of the things that he feels that gratitude and wants to call out. Okay. I guess under the what makes care better, I think there are three things. One is accessibility. And right now, I don't think our country, our state, our city is at the point where accessibility is available to as many people as it should be. Yep. The second one is affordability. Yep. And that gets into the high cost of health care and just that basic notion of affordability, people having to put off things because they can't afford it. And the third is choice. And that has to do with being able to choose the provider that you have confidence in, that you have a relationship with, and some of the barriers that are put up. So I realize that's not medical research, but it is a way that I think our country, if it could move in those directions and improve those things, would be in better shape.
That's fantastic. That's great feedback. Good host. Yeah.
About, what are we grateful for, too? And I just wanted to thank all the great nursing leaders and the nurses that really make things happen 24/7, are discovering with us great partners, and are leading in education and so many other things. So thank you to our 5-time Nursing Magnet Award winners and all the great nurses that help us take care of patients. And then you mentioned this. We're on the verge of personalizing care for everybody, right? Yep. And whether that's the science of their disease and the therapies that are present, but also how you want to receive your care. Yeah. And so we are on the steep upslope at both the university and in the healthcare delivery system on both those angles. So
that's a great call out. And we need a round of applause. Would Angeline and Angie Clark, two of the big head honcho nursing leaders from across the system, round of applause for all they've done through this. Angeline, yeah. All right, and then next table, let's grab another table.
Hello, I'm Kevin Leahy. Our table here, we talked about a few things. First off, we mentioned we have now earlier testing and diagnosis. Examples would be latest, I think, breast cancer testing as well as colon rectal cancer testing recommended at age 40 now. We also talked about better coordination we've got within and among teams here at BJH. And we also talked about our BJH team's efforts, great efforts to help our patients and families. And as an example, one last thing we mentioned, we've got here at BJH, there is Dr. Katrina Peterson, an oncologist. She and her team have started, they're in the process of formulating an early onset colon rectal cancer clinic.
Wow.
So that's in the works.
Fantastic work.
So thank you guys.
And then over here, do we have a winner? A reluctant winner?
I just came along for the lunch. Thank you. I really appreciate it. You're amazing. We talked about a couple things, but actually my feeling is the palliative care and Evelyn's house and all of the hospice houses, I've been to both. Really, unfortunately, I've been to them. It wasn't on a tour. It was actually with a friend and a loved one. Anyway, I just think we need more of those. And I love how the end-of-life care is getting a little bit better where we have our choices of, we have more choices how we want our end of life
Yes.
care to be. And then just as a sidebar, they'll probably tell me to stop, but it's great that the breast cancer, the mammograms, and the age has gone down to 40. I'd really love to see it in the 30s and 20s. I know too many young girls with breast cancer.
So the testing focus. Thank
So,
you for
you know.
sharing that.
Okay.
Perfect. All right. And who's up? Who's up next? Are we running out of volunteer tables over here? All right. Right over here.
I don't want to stand. Can everyone hear me? It's what everyone else has covered. We need health care available for everyone, no matter who they are. I'm a home health care manager, and I see it every day,
Yeah.
that it's only a select people that get the great stuff, and it's not fair. And our BJC, I'm supporter 100%, all my clients, everything. But they need better aftercare.
Uh-huh.
And I'm a 2-time breast cancer survivor, and when I left Siteman, nobody contacted me when I got home. No one. And if you don't have a great family support system, you're left on your own. And I see that all the time. And it's just everyone in healthcare needs to help step up to the plate and make it more available to everyone. I don't care what age they are. They need it. And I'm not picking on anyone, and if I step on anyone's toes, suck it up, buttercup. But too many doctors are becoming boutique doctors. And I understand why they're doing it, but they're taking themselves away from people that really need them, who can't afford to go to them. And then you've got some that aren't boutique doctors, and if you go in their office, all they do is look at the computer, type, and don't even look at you. And that's BJC, Mercy, and all the rest of them.
You hit on a couple of things that I'm so glad you shared that, because those were a couple of the same things I went after too. Thank you.
Also, Evelyn's house is the best.
Ah,
Absolutely the best.
oh, thank you.
All right, thank you.
All right. Anybody over on this side? Oh, we've got Cindy. Oh, Dr. Chase.
Is this on? Yeah. So we have a small table. I got to talk to my wife. After 60 years, it's still enjoyable. Two things. On the scientific front, I think really one of the major advances has been modern genetics.
Yeah.
The ability to look at somebody's genome and tell the severity of the disease, what they might go on to get, and then, as I think John mentioned, to be able to tailor design therapies based on your specific genome, I think is a major advancement. On the more social level, coordination of care, I think, is a big issue. Many of us are fortunate enough to have a large number of doctors. And generally, one doesn't know what the other is doing.
Yeah.
And that can lead to problems. And I think better IT methods of getting information easily available to doctors might improve that. Jean, you had something to say? Yeah. Jean always has something better to say after me.
A small but mighty table, Dr. Chase.
Okay, I would say that the way, is it on?
It's on.
Yep. Okay, that the way palliative care is broadening its efforts to outpatients as well as inpatients early on brings the subject up sooner, so it's less threatening, and plants a seed in the patient and the families, about goals for the end of life and goals with every clinical trial that might be offered. What's the quality of life versus the how it might improve you and to balance that. And I think the earlier you can bring it up, the better. And I think the expertise of palliative care is you're integrating it into the other physician's role. And I think that is fantastic.
Thank you so much, Jean. This is a duo who's been in healthcare a long time. Dr. Chase, if I can brag on you in a second, you've led a VA, you went to a little med school, Harvard, and you know a thing or two about healthcare. So this is a couple. Jean's been a social worker, so I really appreciate you saying that. And then anybody over here?
I don't mind standing. Hi, for those of you who don't know me, I'm Dominic Reeds. I'm the Associate Dean of Research over at Goldfarb. Things I'm grateful for, I have two things that I'm really grateful for. One is that I had the pleasure of working with Lou Chase in the VA endocrine clinic, and within the research ward, a tremendous man, tremendous leader. His grandchildren are just the best. And I also had the pleasure, or displeasure, of having Pat White, Dr. Endowed Professor Pat White, as my intern many years ago, and we just had absolutely the best time together. And I think that brings us to things we can do better. And I think Pat really epitomizes this. And Angie was just pointing this out from our table: is that we have personalized care, but we really need to ensure that we keep the human touch.
Yes.
Because we have a lot of remote care delivery and things like this, but I don't think there's any substitute for being able to be together in person, to have somebody pat you on the back and tell you that it's going to be okay. And something that I think is really, we should be really grateful for, is a very innovative community-based healthcare program that's being delivered by Anna Arbelez in pediatric endocrinology, supported by the BJ Foundation, in which they have a fully equipped van that goes to schools in North St. Louis and helps children who are overweight or have type 1 or type 2 diabetes. There's a multidisciplinary care team. They work with the school nurses, the social workers, the kids, and the pharmacies to really deliver personalized care to the neediest of children.
Yeah, fantastic. Anybody else who wanted to share anything? Or I've got just a couple more slides. Nothing for, all right, perfect. Then, all right, what could we do better? And it's funny, a lot of our feedback was similar. I mean, I think for me, and a couple people really hit this, still way too many people are dying in the intensive care unit. So we've got to come up with ways that we can help to reduce this. You know, we talked about, twice as many Americans are in the ICU unit in the last 6 months of life compared to other wealthy countries that are our peers. So this is a huge opportunity, you know, to be able to give them the support that they need. And one of the problems is that the federal and even state regulations and the people that audit us really make it a lot easier to die in the ICUs than incentivizing the move to these amazing inpatient hospice houses. And I think we're going to need a real unified front to push back and say, look, this doesn't make any sense. Our patients deserve better. The next part is underutilization of remote monitoring. Technology is moving at a rapid pace. We need to deliver more of the care in patients' homes and make it easier for them. And I think along with this, a big part of this at a lot of healthcare systems, the challenge was that nurses are in such short supply right now that we really need to get behind and embrace efforts to get more nurses so that we can move that care out of the hospital and into the homes. This is a fun one for me. The technology is really starting to come along with implanted brain-computer technology for patients that have been paralyzed, whether from like a car accident or trauma, to help them regain function, or some of the neurodegenerative diseases. So they have cool names like Synchron, and the next year you're gonna see some really cool technology coming out there. But you said it in the back so well. You gotta, right now, we do not do a good job of supporting the caregiver, and patients are left all alone sometimes. We've got to incentivize ways to help caregivers make this a little bit easier. You're talking about 1 in 5 Americans are caring for somebody over 18 years old. We've got to do a better job of that. So I think there's going to be a lot of opportunities. Washington University, we are one of the groups that is really leading the nation in this type of work. I'm really proud that of those initial discoveries that I shared, more than half of them were done at WashU or in partnership with WashU scientists. So we are really on the cutting edge of all of this, and that's exciting. And then somebody said it, you know, coordinating care and compassionate care. We've got to get our providers doing that. I know what you mean when I ask you if you like your doctor and you say he's a great surgeon. I know what that means, okay? It means often there's something that we can do even better at the bedside, and we've got to have both moving forward. So I think that's an area that we can make better and we will make better. So I'm excited about that. So at this time, I'm going to see with our online group, is there anything, Emma, that you wanted highlighted?
Not that you haven't already discussed.
Okay, we covered everything. Beautiful. Then I have one last story that is a warning to go through while you're finishing up your cards of either gratitude or ideas for us on what you'd love to hear about. I'm going to share with you the dangers of toothpicks that you might not have been aware of. But before I do that, I want to say, you know, we have such expertise here. You know, in terms of making care more holistic, I'm going to call out Cindy Lefton, who is a PhD who's focused. Sydney, you got to stand up for 1 second. I know you're like the most humble person ever, but her background is she is a PhD, and as a nurse too, was in the emergency rooms helping us to better understand patient satisfaction, and has done a lot of really great things in maybe the most stressful environment in the planet. And we need people like that that are making healthcare more holistic. And she's been on the other side of the coin and really gets this. So having you guys that get this, that keep pushing it forward, thanks so much, Cindy. It means a lot. All right, back to the toothpick story, okay. In September of this past year, my family over here took their first picture where all 4 members smiled at the exact same time. It was what many would have said the high point of the White family on that Sunday. The next day was budget season, and I have amazing bosses, and I'm not just saying that because this is being taped. But I worked through lunch and came home. My nanny makes the world's best taquitos, and I wolfed them down only to learn that I had swallowed a large chunk of a toothpick. Not knowing the dangers of toothpicks, as you all will now, I called my wonderful wife, pictured, who happens to be a gastroenterologist. I said, ha ha, I swallowed a toothpick. She said, do you realize what that means? Half of people in one study that swallowed toothpicks had to get their bellies opened up, an X-lap, because they perforate through your intestines, and 9% of them die. And I was like, oh my gosh. So she said, luckily for you, I know who's on call. I'm going to send you to Barnes West County for an emergent endoscopy. And I learned what it was like to be on the other end of things as I was quickly intubated and had my stomach pumped. Well, by the time that had happened, I had passed the toothpick on and there was no toothpick found. So I called one of the world's most amazing retired colorectal surgeons, the second colorectal surgeon endowed in the United States, and I said, Ira, what the heck do I do here? He said, Patrick, get a loaf of bread and start pounding it. So I pounded the loaf of bread like you wouldn't imagine, swallowed the entire loaf, and 3 days later, my toothpick came out. I desperately wanted to show the slide. Later this year, I'm doing grand rounds at Harvard, and I wanted to show the slide of the toothpick on the other side. And my wife, who's a gastroenterologist, assured me I will never be invited to give a talk again if I showed it. But Dr. Codner, thank you for saving my life. Thank all of you for being such a great audience and sharing with us these experiences and what we can do better. This has been the most fun talk I've given in some time. Thank you.
That's a tough one to follow. I have seen the picture of the toothpick, and you're not missing much. But it's a great story from a good friend of ours and a great doctor. You know, life's journey is complex, and so is our healthcare system. You can tell by the things we've been talking about today. Patrick's insights, and so many of yours, have been enlightening, and I feel certain you share my comfort knowing his expertise, knowledge, and dedication are leading the way for patients and families everywhere to have the best end of life possible. I know that I've learned a lot from just hanging around Patrick about what I'm going to do when the time comes, and I'm going to find him wherever he is, or any of his team, to help me through that. But thank you all for joining us here at this Legacy Circle celebration, and for your valuable partnership, generosity, and commitment. It's been an honor to recognize you today for the special legacy you're creating for generations to come through your gifts. Now, if you ever have any questions about what's going on at the hospital or the foundation with our partners, or about your gifts to the foundations, please contact us at any time. Thank you again. Have a wonderful afternoon, and we look forward to seeing you soon.